When researching full arch replacement of all of your teeth, it can be somewhat daunting and complicated because there are many different alternatives that are out there. Here in our office, we offer many of those alternatives. And so we have the ability to individualize the treatment for the best option for each patient.
There's no cookie cutter treatment plan for every single patient. We identify each patient's problems and treatment plan them according to their specific needs. We want patients to come to our office and feel comfortable here. Know that we're working through this together. We sort of take their problem, making it our own personal problem.
Several years ago, a patient, Susan, came to our office for an evaluation for treatment. She came out of desperation. She was very fearful of the dentist, hadn't had dental treatment for a very, very long time, and came because of her, at that point, inability to eat. She felt she couldn't smile, her teeth were loose. She was afraid if she bit into anything, her teeth were going to go ahead and fall out. And it got to the point that she really just couldn't function properly in her everyday life. Following a careful evaluation and gathering all the data, we put together a treatment plan that we felt that we could meet the requirements that Susan requested. And we could place implants, we could give her fixed permanent teeth, where all her teeth were going to have to be replaced. And we could do that in a manner that she was comfortable and aesthetic and had nothing movable in her mouth.